The following article is a production of the Conscious Evolution Institute. Sermorelin acetate therapy with GHRP6. With sermorelin acetate therapy, it is possible to restore youthful vitality and alleviate the effects of the aging process that result from human growth hormone deficiency. Sermorelin is a safe and effective hormone substitute which has the capability to naturally stimulate the human pituitary gland in order to encourage the secretion of our own internal stores of human growth hormone. HGH is secreted by endocrine organs known as somatotropes located in the anterior pituitary. Although as we grow older, the body drastically slows down production of HGH over time, the somatotropes never lose their ability to produce healthy levels of HGH. This is why sermorelin injections are an effective treatment for growth hormone deficiency. What is sermorelin? Sermorelin is a biosynthetic form of a hormone naturally produced by the hypothalamus, known as growth hormone releasing hormone. GHRH is the means by which the brain sends a request to the pituitary to release HGH. GHRH is delivered from the hypothalamus to the pituitary gland via a pathway of blood vessels known as the hypophyseal portal system. How is sermorelin different from bioidentical HGH? Unlike bioidentical human growth hormone replacement therapy, sermorelin acetate is not structurally identical to GHRH, but sermorelin acetate is functionally capable of producing the same biological effect on the body that is achieved naturally through GHRH. Sermorelin acetate is a truncated form of GHRH, which means that the biosynthetic hormone is structurally identical to the active portions of the GHRH molecule, while omitting portions of the molecule that are inert and do not encourage the release of HGH. Although the sermorelin molecule is not naturally produced by the body, there are no adverse effects related to the exogenous nature of the hormone. This treatment is perfectly safe. HGH decline begins around 30. Adult human growth hormone production reaches its peak by the time we reach the age of around 20. Over the course of our 20s, we sustain high levels of HGH production, which help us sustain ourselves physically, cognitively, and psychologically. By the time we reach the age of 30, however, growth hormone production starts to decline at a slow yet insipid rate of 1 to 2% each year. Although this might not seem like a significant amount at first, this amounts to an average reduction in endogenous HGH production of around 14% every 10 years. By the time a decade of decline has occurred, the human body only produces 40% of the human growth hormone emitted during the period of peak production in our early 20s. Symptoms of HGH deficiency. This decline in HGH secretion does not come without significant health consequences. HGH deficiency is correlated with a number of symptoms and syndromes that we take for granted as simply a part of the aging process, such as immune suppression, decreased cognitive sharpness, wrinkles and deep lines, increased adipose fat, especially around the midsection, reduced libido, fatigue, reduced willpower and motivation, and many other symptoms throughout the body. Benefit of sermorelin versus other treatments. Although HGH hormone replacement therapy is a safe and effective means of restoring healthy human growth hormone levels, sermorelin acetate injections completely eliminate the risk of overdose, while encouraging the pituitary gland to be responsible for the dispensation of HGH, rather than self-administration techniques. Sermorelin acetate presents no risk of HGH overdose because HGH production by the pituitary is downregulated by effective biological negative feedback mechanisms. Sermorelin and somatostatins. When the brain feels that the human body has a sufficient amount of human growth hormone necessary to maintain optimal health and hormone balance, the hypothalamus releases the inhibitory hormone somatostatin, which blocks the uptake of sermorelin and GHRH by the hypothalamus, preventing the brain from overloading the body with excess HGH. Because of the effectiveness of somatostatin at effectively regulating the pituitary, the risk of growth hormone overdose via sermorelin injection is nearly impossible. Clinical body fat reduction using sermorelin. Clinical trials show that after a single year of sermorelin acetate therapy, it is possible to achieve a 20% reduction in adipose fat tissue. The majority of this fat tissue is eradicated from the midsection. Fat from the waist, hips, and stomach decline by around 30%, while weight loss occurs via marginal areas of body fat such as the legs, arms, and neck, and chest at a percentage of around 13%. Sermorelin is delivered via injection. Sermorelin acetate is a low-risk treatment which is delivered via small injections just below the top layers of the skin, known as a subcutaneous injection. These shots are simple to administer, and patients generally perform their own injections in the privacy of their own homes or offices. Why is sermorelin combined with GHRP6? Many treatment protocols combine sermorelin acetate therapy with GHRP6. GHRP6 is a synthetic hormone which functions similarly to sermorelin by encouraging the healthy stimulation of the pituitary gland. Although the two hormones achieve the very same end, they do so via different chemical pathways and enzyme reactions. GHRP6 is useful because it helps emulate the normal biological cycle of HGH release, providing more noticeable gains in HGH levels than sermorelin acetate injections alone, while still producing biologically safe levels of human growth hormone. GHRP6 and ghrelin. GHRP6 shares no significant structural similarity to any hormone produced naturally by the human body, but synthetic GHRP6 has been proven to encourage the production of growth hormone by stimulating the biological effect of the hormone ghrelin on pituitary stimulation. Ghrelin is primarily produced by the stomach and plays a significant role in gastrointestinal function, but the hormone also influences HGH production as well, which is not surprising considering that human growth hormone stimulates cellular metabolism. Ghrelin is an acronym for growth hormone releasing peptide. The effect of age on GHRH production. GHRH is released at its highest rates during our youth, which corresponds directly with the rate at which our pituitary gland releases HGH at its most abundant. As we grow older, GHRH levels start to decline, leading directly to a deficiency of human growth hormone, which speeds up the aging process and reduces overall health and well-being as a result. HGH deficiency is also referred to as hypopituitarism, relating to the suppression of pituitary function which causes the organ to release insufficient levels of vital growth hormone. Phases of HGH decline. At first, the effects of hypopituitarism are qualitative in nature and relatively hard to measure, yet vivid to experience. Low HGH first affects energy levels, which can affect overall motivation and suppress innate desires. After energy levels start to decline, the body starts to experience greater levels of fatigue on a physical level. Aside from being sapped of mental energy, the human body loses its ability to sustain itself in the face of high levels of activity. Endurance starts to decrease significantly, and during this period, the body becomes less prepared for high levels of physical exertion, and gains from exercise start to decline. Also, the body's capacity for restorative sleep starts to decline, exacerbating further decline. During the third phase of HGH deficiency, overall health starts to decline as a result. Early in this phase, aesthetic skin health starts to decline rapidly as wrinkles and deep creases start to develop. Cholesterol and triglyceride levels increase. Hypertension often develops as a result of cardiovascular strain and arterial plaques. The body begins to seep calcium from deep within the bones, which inevitably leads to symptoms of osteoporosis over time. During this phase, the body not only responds less readily to exercise, but it will be difficult to make any significant gains at all. And in worst cases, the exercise will only serve to prevent muscle atrophy from occurring. Goal of sermorelin therapy. Sermorelin therapy with GHRP6 has the potential to alleviate or even reverse many of the symptoms of HGH deficiency and aging listed above. The Conscious Evolution Institute is one of the premier anti-aging clinics in the country, and we specialize in the legal and legitimate use of hormone replacement therapy as a means to encourage a longer life with enhanced health outcomes. Our fully trained and board-certified staff of clinical specialists and physicians are dedicated to helping our patients live a longer, healthier life that is full of vigor, energy, and characterized by an overwhelming sense of well-being. Meet the new you with sermorelin and GHRP6. Sermorelin acetate therapy with GHRP6 is a verified safe, effective, and biologically self-containing means to stimulate the pituitary to produce healthy and normal levels of human growth hormone by emulating the effects of GHRH and ghrelin on somatotroph activity. Sermorelin GHRP6 is available at numerous pharmacies across the United States and is generally compounded on-site by a licensed pharmacist. Sermorelin acetate is not subject to the same restrictions as bioidentical human growth hormone and is available with a physician's prescription. Unlike HGH hormone replacement therapy, there are no legal restrictions placed on the prescribing physician in regards to his or her medical expertise and opinion, and as a result, Sermorelin injections can be prescribed off-label in order to treat many symptoms of HGH deficiency that have been clinically shown to be beneficial, yet have not been approved by the FDA. Sermorelin acetate injections from the Conscious Evolution Institute. The Conscious Evolution Institute specializes in comprehensive and remote hormone replacement treatments. Although we diagnose and treat our patients remotely, we still play an intimate and responsible role in your medical treatment, providing advice as well as diagnostic services in order to ensure the safety and effectiveness of your hormone treatment. In addition to providing services that directly relate to your medication, we also provide nutritional, dietary, and exercise advice in order to help you maximize the effects of your Sermorelin treatment. Sermorelin is highly effective even without making the choice to alter your lifestyle, but committing to a life of more responsible and healthy life choices will help you potentially see the incredible results over a relatively short period of treatment. Conscious Evolution Institute Medical Services. A full list of services we provide, either directly or via local affiliate, are pre-treatment medical questionnaire and self-evaluation, initial physical examination, diagnostic testing, prescription hormone therapy, administrative services, monthly doctor's assessment, workout regimen, and nutrition plan. HGH and IGF-1. After human growth hormone is released into the human body, HGH circulates through the body for a brief period before being mostly converted into a hormone known as IGF-1 in the liver. IGF-1 is the primary vehicle by which human growth hormone affects its incredible age-defying characteristics. Increased levels of IGF-1 circulate through the blood and boost the rate by which metabolism occurs, providing increased energy levels to all aspects of physiological function. In addition to this, IGF-1 stimulates the healthy development of new cells within the bones and the various organs throughout the body. This pattern of cellular replacement is normal, but slows down significantly as endogenous levels of HGH decline. Increased levels of growth hormone and IGF-1 revamp this muted process, allowing the body to rebuild itself at a pace which protects human youth and vitality more effectively. Sermorelin and GHRP6 frequently asked questions. What are the benefits of increased HGH production via Sermorelin and GHRP6? Increased structural integrity of the bones with improved calcium retention. Improved sleep quality predicated by increased REM sleep. Boosted immune health. Higher levels of stamina. Improved muscular strength. Thicker, fuller hair. Enhanced emotional health with increased vitality and energy. Improved cardiac function. Speedier physical rehabilitation from surgery and injury. Increased metabolism which burns adipose fat. Smoother, tighter skin. Increased muscle mass. Enhanced libido and restored sexual ability. Improved cognition. And enhanced renal function. How do I use Sermorelin? Sermorelin acetate is only available via injection. These injections are generally provided once daily before bed, but dependent upon your particular health goals and the advice of your doctor, you may decide to administer your injection either early in the morning or before you engage in exercise. Nighttime injections are generally recommended because HGH production primarily occurs during sleep. Dosage will depend upon your individual hormone profile, along with your age and gender. Should I use Sermorelin or HGH? Both of these are viable treatment options for patients over the age of 30. There are fewer restrictions on the usage of Sermorelin acetate therapy, though both treatment options provide similar potential gains. Some patients claim that HGH produces results at a slightly faster rate than Sermorelin alone. When combined with GHRP6, however, physiological changes take place more quickly as a result of the biological pathway of GHRP6. Sermorelin acetate therapy is much cheaper than human growth hormone, but some are more pleased with the results that they receive from the direct injection of HGH. What are the side effects of Sermorelin? Sermorelin acetate therapy with GHRP6 has a small risk of side effects. The most common of these are swelling and pain around the injection site. Some other patients experience itching because of injection or difficulty swallowing. Although these two side effects are not dangerous, it is important to let your doctor know so that corrective measures can be taken. In very rare cases, other side effects occur, such as vomiting, hyperactivity, headache, and dizziness. These symptoms should be reported to a physician immediately if they occur. How can I get Sermorelin with GHRP6? If you are interested in Sermorelin therapy, the Conscious Evolution Institute is your quickest and best source for hormone replacement therapy. In any case, you should only choose a physician or clinic which specializes in hormone balance or is highly experienced in the field of treatment. The Conscious Evolution Institute specializes in hormone replacement therapy for adult-onset hormonal deficiency. We maintain regular contact with our patients and provide regular diagnostic testing in order to ensure the therapy is both safe and successful. We provide reasonable payment plans to help you afford and pay for the treatments we provide at a rate which conforms to your budget and needs. Sermorelin acetate treatments potent and beneficial. Sermorelin acetate therapy with GHRP6 is a fantastic therapy for those suffering from adult-onset hypopituitarism. If you feel that you are suffering from the effects of the aging process and that HGH deficiency may be speeding up your decline, Sermorelin injections can help you restore physical health and alleviate many of the most significant effects of aging. Sermorelin acetate, especially when combined with a conscientious lifestyle, can help you add years to your life while shaving years off of your old age. We encourage you to call or contact the Conscious Evolution Institute today. This audio program was a production of the Conscious Evolution Institute.